a framework hinders your ability to be yourself, to be thoughtful, to use your noggin, to think critically, which is where I think it hurts students on CASPer and the MMI. Ask Dr. Gray Pre-Med Q&A brought to you by Blueprint MCAT. How are you doing today, my friend?
I'm doing well, Dr. Gray. How are you doing?
I'm wonderful. What can I help you with?
So my question regards to CASPer, and specifically I have a question with regards to how the timeline of taking the CASPer test factors into how the primary application gets verified. Mm-hmm. And so I was wondering if you could give some information about the timing to take the CASPer test to make sure that if it factors into the primary application verification, that your marks are in time to have it verified. So if you could speak towards that, that'd be great.
Easy answer. It doesn't. The primary application verification for all three application services is personal statement, activities, at least one school selected that you're applying to, all of the basic demographic information, and then some specifics with like TMD-SAS. They have a required extra essay. They have an optional extra essay, any sort of disadvantaged essay that you want to include. And then obviously transcript information goes on there as well. So that's what's required for verification. Even letters of recommendations, things like that, are post-verification. You can change those. They can be updated later. The biggest things, transcripts, essays, outside of secondary essays, you don't even need an MCAT score to get your primary verification done. So think of CASPer timing as part of a secondary application. Focus on that primary application, and if you can fit CASPer in, great. If you can't, that's okay. Think of it in terms of it's just an extra secondary essay that you have to do.
Okay, so ideally you would have the schools would be able to have the CASPer mark with your secondaries and your MCAT, and so that's when your application can be reviewed.
Potentially. And the frustrating part about this process is it completely depends on the school. It depends on how the school is using it for their admissions decisions. They may not be using it at all. They may require it for data gathering so that in 1 year, 2 years, 5 years, they can go, okay, we have enough data here. Does CASPer add anything to our admissions process? They may be using it to screen for interviews. They may not be using it to screen for interviews, but to screen post-interview to determine if they want to accept you. So don't worry about all of that stuff. That's just super nitty-gritty details that nobody needs to know about, other than think about it in terms of secondary timing so you have it done just in case one of those schools that you're applying to is going to use it for an interview invite potential.
Okay, awesome. Thank you for that information. And then just a follow-up with regards to CASPer. There's a great episode that you did on the pre-med years, episode 303. It was with Dr. Kelly Dorr, one of the founders. So I highly recommend anyone check that out because it's a great episode, and I learned a lot.
She's one of my favorite people.
Mm-hmm. And so I wish I came across that before I wrote my first CASPer, that's for sure. And one of the questions, kind of an open-ended question, is what do you think would be the best way to prepare and practice for the CASPer and not risk sounding cliche, but still touching on some of those core constructs that they may be looking for? What would you say with regard?
Well, you've taken it once, right? Or you wrote it once, as our friendly friends from up north say. What do you think would have helped you preparing since you've already done it once?
Mm-hmm.
I'm flipping this around.
No, it's, I have done some reflection on it. And one of the traps that I think I fell into, and again, this is all subjective just as a CASPer taker and a student, so by no means an expert. But one of the things that I will do differently if I have to retake the test is I won't be looking at online expert answers and scenarios. Because I felt that I got into a little bit of a rabbit hole when I was on the test trying to answer questions, because I was trying to fit in, not making assumptions and talking about these different sides and going through the prompt or the question in a way that these expert answers kind of
Yeah.
frame it.
Yeah.
And it caused me to not be able to answer all the prompts
Well,
very well.
I'll reword your answer. It caused you to not be true to yourself.
Mm-hmm.
And yes,
Yeah.
it slowed you down, but it caused you to not be true to yourself.
Mm-hmm.
What you're talking about are all of the frameworks, which I hate. I hate frameworks when it comes to answering questions. Right?
Mm-hmm.
I always talk about the STAR method because that's the one that most people know about. Okay, what's the situation? What's the blah, blah, blah? I don't even know. I've chosen not to try to remember what each thing means. I just know situation. Maybe ours results. I don't know. But at the end of the day, when you use frameworks from those expert CASPer people out there who would love to charge you $1,000 to take their CASPer course, which nobody needs, when you use those frameworks, you are no longer being yourself and you're forcing yourself into this box that maybe you're like, well, that's not really how I would talk, but I guess for this is how I'm supposed to do it because the expert said so. In my mind, you don't need to prepare for CASPer. And I know that's completely ludicrous to think that. I think you just need to go and go, oh, this is a tough situation. Here's how I'd think about it. Very similar to how we do MMI prep. I don't think you need to prep for the MMI. You need to understand it. To do well on the MMI doesn't mean practice and practice and practice and practice and framework and framework and framework and framework. It means going in and using your brain to think through a scenario that you probably haven't seen before. And it's the same thing with CASPer, is we as human beings have brains that are capable of processing a ton of information, coming up and thinking and critically thinking about these different situations that are being thrown at us. We have the ability to think through those things on the CASPer in an MMI created by the same people, right? Without needing a framework for that. And yes, you're like, oh, well, shoot, I wish I would have mentioned X, Y, or Z. But we do that with everything in life. We always can do a postmortem and go, oh, man, I wish I would have said X, Y, Z, whatever.
Mm-hmm.
A framework doesn't help you with that. A framework hinders your ability to be yourself, to be thoughtful, to use your noggin, to think critically, which is where I think it hurts students on CASPer and the MMI.
Yeah, and I think that's those are pertinent points. And one of the things I noticed is when I'd be giving answers, I would talk about how I'd want to speak with someone in a private room, and I would try and touch on these things that were probably very cliche, and raters probably saw them over and over because they're common to see in expert answers.
Yeah,
and I think that really kind of hurt my chances. I also didn't know that bullet, because there's a lot of competing information, but I didn't know until I listened to that episode on the pre-med years that bullet points were a good strategy.
Yeah.
And that's kind of a segue into a question I have, which is, how might you go about potentially using bullet points for students, or if there are any tips for bullet points for students that might want to utilize that strategy due to their typing speed being not the best.
Yeah, it's a great question. One I haven't talked about at all, but depending on the scenario, right? It could be a scenario about you find a wallet in the store. What do you do with it? And instead of typing, well, here is what I would think, and I would also be worried about this, and then this is also another thing, right? And it's taking all that time to write these full sentences, this paragraph. You could potentially just go, these are the things that I'm thinking about. Bullet point 1, bullet point 2, bullet point 3, bullet point 4. After thinking about those 4 things, here's what else I would want to know about.
For sure. Because one of the things that I think I got trapped in is I really spent time trying to think about both sides of an issue and try and go through kind of an if-then thing where I would need some new information and then I would do this. But, sometimes it felt a little bit too structured, I guess. Maybe it's not that it's a bad thing not to do that, but maybe bullet points might be able to help you out with regards to laying out some of those ideas.
And at the end of the day, I don't think CASPer wants you to go, okay, well, this is the potential first scenario. If this happens, then this is going to happen, and then this is going to happen, and then this is going to happen. But if that happens, then this is going to happen, and this is going to happen. And they don't need that. You don't have time for that. You need to back up a little bit, get a little bit higher level, and think big picture. These are the issues that are at hand. These are the things that I want to think about. Yes, there are consequences to that thinking. Those are the consequences. But I'm okay with those consequences because of X, Y, or Z.
Okay. Okay. Yeah, that's some good advice, because that's some of the things you hear online is going through those different scenarios, and that's a really good way to think about it.
You don't have time. You got lots of questions to answer and not a lot of time, and depending on your typing speed and just overthinking brain that you may have, I think it's perfectly fine. Stay a little bit more superficial, but go through the thought process.
Okay. And a quick question about the test taking strategy, because I know that, you understand that it's hard for applicants to hear, oh, you don't really need to prepare, right?
Yep.
And so do you think that there's a way that applicants can kind of navigate, still wanting to practice and reflect on answers that they've been given, but not putting too much weight on, these trying to find the right answer, but more so a reflective approach? Is there some merit to that?
I don't think so. I think you need to go through Altus's, not scenario. They're kind of like sample tests that they have. So again, that you understand what it looks like, how it works, and then just trust yourself at the end of the day. We, as human beings, are put into situations, put into scenarios all day, every day.
Okay.
You've practiced for this your whole life. But for some reason, when it's on a computer, like put into this little vignette of a video or a text that you have to read, then it's like, oh my God, I need to prepare for this. But dude, this literally happened to you 3 months ago. You don't need to prepare for that. You just have to remember what you did and potentially think about what you wish went better.
I think that answers some of these other a couple other questions or points that I wanted to bring up, because something that my understanding about kind of CASPer scoring and CASPer raters is that they're given this kind of background in theory that gives the rater a sense of what CASPer, the test designers, are looking for a given scenario.
Yep.
And I just wanted to get your opinion on what you think these constructs or these backgrounds in theory might be, and if there's any merit to kind of trying to reflect on them on a deeper level. Some things you hear very often is empathy, compassion, communication skills, collaboration, etc.
Yeah, that's called being a human being.
Mm-hmm.
It's like, do you not show compassion or empathy in your normal life? Do you not have teamwork in your normal life? Again, that question goes right back to the experts say, just be yourself.
Okay.
Just be yourself. Don't try to gamify it and go, okay, I know for this type of scenario, I've read the experts said that these are the 4 traits that they're looking for. So I need to make sure that I hit all 4 of those traits and check, I'm done. And that's just not how it works. Yes, they're obviously working off of some sort of rubric that you don't know what it is. Who cares?
Okay.
Be yourself. Older student I worked with, David, who's now, he's a 3rd or 4th year student in medical school now. His best line after taking CASPer earlier on when it first came out was, "Don't be a psychopath and you'll be okay."
Mm-hmm.
Right? And that's obviously a little bit kind of blasé about it.
Mm-hmm.
But at the end of the day, it's kind of what it is. Be a normal human being, care about people, and tell me what you think.
Okay. Yeah, I understand where that's coming from for sure. And this kind of answers the next question as well, because I know that, or at least my understanding is that the raters are also given, why these constructs are important to medicine, but essentially, just that's neither here nor there. Like, just having a basic understanding of why they're important. You don't need to dig deeper on these specific constructs or even like the 15 core competencies, that kind of stuff. You wouldn't recommend that. Just go in there, be familiar with the test.
Be familiar with the test. Just go be yourself.
Okay.
Yeah. And I personally don't think that you need, as you're answering the question, think about how does this tie into medicine and work that into your answer.
I beg your pardon?
I don't think, as you're going through this, that you need to think about how does this tie into medicine and put that into your answer. The same way I don't recommend, and you're in Application Academy, you'll find out, I don't recommend when you're writing your activity descriptions tying everything into medicine. Be like, well, this one time I was a soccer coach, it's going to prepare me to be a doctor because of whatever. You don't need to do that.
And then this is a kind of a content question is, there was a Q&A that you did with Dr. Kelly Dorr. I believe you posted on Instagram about CASPer. This was back in 2018. So I don't know if any of that content is still around on your Instagram page, but I had a hard time finding it. Do you know if students might be able to access that Q&A or that thread still?
Anything that I've done with Kelly is either episode 303, which you mentioned earlier, and then on National Premed Day she was on. So on YouTube, on our YouTube channel, go look for National Premed Day material, and it would be there. Awesome.
And then if we do have time for a couple of quick questions, just to conclude.
Sure.
I know you hear these types of questions a lot, like is this clinical? And so one of the experiences that has been deeply helpful for me, but I don't know if it can fit on the application, is I've been attending teaching rounds with physicians, learning about their teaching methods, the pedagogy, and understanding differential diagnoses and kind of that more how do I say, application type style of learning. And it's been very interesting to me, but I just don't know if that fits into something like shadowing, because I'm not there with a patient. I don't know if it fits in anywhere, and thus if I should include that, I'm happy to provide more information. But that's essentially.
So, what is shadowing?
Shadowing, my understanding, is observing physicians in their day-to-day lives in the clinic.
Everything was right until you said in the clinic.
Okay.
That's the goal of shadowing, is to understand the physician's life. Period. Right? You're not going home with them to see what they're doing at home, but what does work look like? And this is why when I talk to nurses, and nurses are like, well, I work with doctors all day long. I'm like, yes, you work with them at the bedside, but what do they do when they leave? You don't follow them. When they go to the doctor's lounge, put their feet up, and then go talk to the insurance company for 5 hours. What you're witnessing is teaching, which is a little bit weird in your mind. Be like, well, how's that shadowing? But it is, because that's what academic physicians do. They teach. That is shadowing.
Okay. Yeah, that answers my question. Because it's a little bit of a unique situation. I don't know if that's pretty common for people to go to teaching rounds or anything like that, but I've really enjoyed it. So if you have the opportunity to do so, I would recommend it. And then lastly, this is I think this is a little bit more of a tenuous connection to clinical experience, but as a grad student, I've been involved in recruiting patients for my clinical study. And I know that chart review and obtaining informed consent, those aren't clinical. I know you can smell the patient, but it's not with regards to their care per se. Is there a spot in the application where something like that might fit, where you're being able to talk about the experiences you've had educating patients about clinical trials and other like research, being able to incorporate your experiences working with clinical staffs and all the things that it's meant to myself, a potential or an applicant, informing your or watering your seed per se of being able to see that. Is there a place for the application?
In the activity section, there are 18 different categories for activities,
Mhm.
ranging everywhere from paid clinical, volunteer clinical, paid non-clinical, volunteer non-clinical, research, poster presentations, awards, what else? Hobbies, intercollegiate athletics. They have it all, right? You have 18 different categories. Don't quote me on that number, but I think it's 18. So yeah, that would be either paid or volunteer, non-clinical. And you can talk about it there.
Okay, because the issue I had is, I guess it's a part of my graduate school, right? So it's not, I guess, volunteer because I'm doing it as part of my schooling, but it's not paid, even though I get a stipend because it's part of my schooling. I guess that's kind of one of the issues I had is I was
put one of them, either paid or non-paid. It's up to you. There really are no rules around that as long as you're not like lying about stuff. Because students will put their study abroad program in the activity section. I don't know if I necessarily agree with that because we kind of colloquially it's a hard word for me to say. We kind of call it extracurricular activities, right? And so a study abroad program is curricular. This thing that you're talking about is curricular-ish, but then people will put research in their application that they did as part of a class or whatever else. So I think it's perfectly fine to put on your application. Just call it volunteer, non-clinical.
Awesome. Okay, yeah, that really helps. That gives me a good sense of kind of where those fit. So I really appreciate your time, Dr. Gray, and your expertise. So thank you so much.
So what are you doing about the MCAT?
So I have written the MCAT.
Okay.
I wrote the MCAT in September of last year.
Okay.
And so I plan on applying this year.
Nice. What's your biggest piece of advice for the MCAT?
My biggest piece of advice is be resilient to individuals. So I've written the MCAT 3 times.
Okay.
I wrote it once and I got a 504. I wrote it a second time, I got a 512, and then I wrote it last time, I got a 517.
Nice.
So for people out there, you can improve.
Yep.
It just takes some practice and some time, and you don't have to be a genius. So just staying resilient is the biggest piece of advice, because normally during coursework you get these carrots, right? Of, oh, I got a good grade on a lab or a test. The MCAT, there's no carrots. Right? There's no,
yeah.
You have to keep going.
Patting yourself on the back.
And also do cars every day.
Yeah.
Every day.
Yeah.
It's not like the science sections. You can't just, study biochemistry for one day and then physics the next day. You have to do a few hours of cars every day. You have to spend as much time reflecting on the cars as you do the actual passages.
Yeah.
I'm no expert by any means on the MCAT, but those were my experiences. And cars was my biggest
nice.
my biggest hurdle, I guess you could say.
Did you utilize any Blueprint MCAT full-length exams in your prep?
I did not. No,
Why not?
I didn't come across your material until after I wrote the MCAT.
Okay.
Or any of the Blueprint stuff either.
Okay.
So it was just happenstance that I didn't have the opportunity to use any of those materials. But
all right. We need the Blueprint to have a bigger footprint in Canada, I guess.
Yeah, I mean, I wish that I came across them earlier, for sure. But no matter what, this was my opinion. Again, take it for what it's worth. But no matter what prep stuff you're using, you have to do all the AAMC stuff.
Definitely.
No matter what, like in my opinion.
Yeah. No, that is the opinion of everyone, including Blueprint, including I'm gonna say it for Princeton and Kaplan Review, Princeton Review and Kaplan. You have to do the AAMC stuff. Like that is 100% necessary.
Yeah, yeah. So those would be kind of my messages to people who are studying for it. I could spend the next 2 hours plus, probably days talking about it, but. Yeah. Overall, it's not the end of the world, and if you're going through some struggles, it's just a number. Your score is not who you are. So